Yes. Then promiscuity, you know, even armed robbers. No robbers go on the road just with same mind. Majority of the robbers, kidnappers, those are not businesses that people do with same mind. They have to depend on one substance or the other to be able to do such things.
The issue of mental health is something that is affecting so many families. Yeah. And when you look at some people, how do we begin to understand that something is wrong with a person in a family?
Okay. Because
we see a prevalence of misnomer activities, and when it happens, people take it for granted that there's nothing. And when it happens too, when do you advise that families, friends, and the like should take appropriate action to do some corrective measures?
Okay, well, some of the very early signs you will see is that when someone loses touch with reality, okay, the mental health is affected. When we talk about mental health, we are talking about someone's ability to recognize his or her abilities, utilize that ability positively, okay, able to cope with the day-to-day stresses of life, and able to contribute productively and fruitfully, you know, as a worker or a student, and also to impart his or her community. And once someone can function at that level, we say the person has a good mental health. And the moment there's a deviation from that, then you will see that most often the individual will lose his touch with reality.
How do you describe people that are hyperactive?
Hyperactivity could be as a result of substance use, not necessarily that the person is mentally ill.
Okay.
Yeah. And it could be due to, if it's a child, there's what we call, you know, attention deficit disorder in psychiatry. It means the child has a problem. He has a lot of energy, and he will not be able to discharge. He wants to do so many things at a very high pace, and so that doesn't necessarily mean that the individual is grossly psychotic. That can still be controlled at our center when they are brought to the child and adolescent.
It means it's acting beyond
the normal. Yeah, the normal way a child of that age should act. But when someone is psychotic, he loses touch with reality. Well, he may see things you and I will not see. He may come here now and tell us that angels are here, Chief Obasanjo is here, and you can't see the same thing. And he may hear voices of people that have long passed on to glory, that are related to him, or may not even be related. And yet other people will not hear such voices.
Being paranoid?
Not necessarily paranoia. The individual, we call it hallucination.
Okay.
Then he may also be feeling things you and I don't feel. He can tell you that things are crawling on his skin and you cannot see anything there.
But are they real?
And the feelings are real to them.
They are real?
Yeah, they are real to them.
Well,
it's
God
part
help
of
us.
the illness.
Well, I want to look at Neuropsychiatric Hospital, which is a World Health Organization center, and how you've been coping with issues of mental health. Probably people need to understand why the Neuropsychiatric Hospital was established.
Well, the then late Professor Adeoye Lambo, as a young physician and who is specialized in psychiatry, and saw the need that the nation did not have any as at then. And what we have was just, what do you call it? After the Second World War, we have Yaba Asylum. Okay. And later, then there was also one asylum in Calabar, and then at Lantoro Annex, which is our annex now, was established. But he came in with this modern psychiatric setup and got a land at Aru and established this modern psychiatry that we have to take care of soldiers from the Second World War. We were having psychological
just problems.
Soldiers? Not only soldiers, but majority of them then were soldiers. They were people who fought in the Second World War. You know, there's what we call post-traumatic stress disorder in mental health.
Maybe from gunshots or whatever.
Because of the violence and the traumatic effect of the war, it affected some of them. And so they begin to react to that, and they needed to be careful. And here is a young psychiatrist. You know, he needed to put his training to use. Expertise, yeah. So he came up with the idea. And so ever since, the institution has metamorphosed to a world-class institution that it is today. At Taro, we are not only treating mental health, we are also a training institution.
Okay.
We train professional, mental health professionals across board, nursing, medicine, and then we train clinical psychologists, and then we also train help other institutions to train their own healthcare personnel. But
when you look at the level of social headaches, challenges, and financial constraints, are you noticing any change? Is it affecting the society in a way that is bringing more patients to your environment?
It does, sir. The economic hardship is affecting everybody in the society, especially the less privileged. People cannot eat 3 square meals a day. Many cannot pay the school fees of their children and wards. And all of those things have psychological effect on a father or a mother. And then you see a high rate of divorce in the society. People are now intolerant of each other because they are not able to meet their own expectations.
Even unemployment?
Unemployment is high, and even some that are employed, the salary does not come to time. So all of these put stresses on the individual, and the end effect is that it affects the mental health of the individual. And so we are having a high rate of people breaking down. And then the worst of it is even the increase in substance use. In time past, there are so many substances that are in existence now that our youth can compound together even in the lab that we don't even know of. And so because of the high rate of substance use, a lot of people are breaking down.
Are you attaching that to the global connection?
Yes, it is. The IT world, I know the IT has made the whole world a global village. So people can learn anything. Sitting down in their room here in Abeokuta, they can learn things from US and Australia and all that. And they don't, youth generally, they want to experiment. They want to try whatever thing they are seeing, and they have tendency to explore. So that is affecting the whole thing.
So what is the role of parents, guardians, school authorities, and the like in understanding
this
deviances?
Parents need to step up their own game. We are in computer age, where from nursery school, children are taught how to use computer. And even with my own level of education, there are so many things I cannot do with my cell phone that my children could do with it. So, but you have to learn. You have to just keep pace because the world is evolving. And so if you don't learn, the children are miles ahead of parents, and that is a big challenge for most parents. So if they're right under your nose, they can be pressing the buttons and doing so many things wrong without you know. But if you have some knowledge of these things, you are able to track them. Then we advise that parents befriend their children. Get to know your children, and let them see you as a friend, and then get to know their own friends, and then who they are, not just by name. Know them by face, know them by voice, and know where they go to and who they associate with. It's important.
Are you getting, or is a Neuropsychiatric hospital getting partners to assuage all these ill feelings, inadequacies, and the like?
Well, we try to reach out to, you see, because of the way people view mental health in our society, there's a lot of stigma. And even the rich don't want to associate with us. Nobody wants to build a structure and be named after them in Arrow. So they see it as, oh, maybe he or she has a relative who is mentally ill, or maybe himself even have the problem. So those are a challenge for us. Though we would have loved to have people come in and partner with us, but our Provost and Medical Director, Dr. Agbola, is doing his best to woo people to come to our aid. So far, we cannot really say that we are having the best in that area the way we want it.
Does it mean there's a lack of enlightenment, education on the part of government, or that government is not taking adequate steps or adequate funding to ensure that all that are required are given to ensure that mental health issue is resolved in Nigeria?
Well, government is doing their best. I'm not in a position to speak as per how much you are getting from the government or whether it's adequate or not adequate. Okay, the CEO of the hospital is in the best position to answer that. But one thing I know is that the government have a part they are playing in assisting us financially. We are, as a federal institution, we are supposed to be getting some subvention, though I can assure you, sir, that it's grossly inadequate. From the feelers we get from our leaders, it's not adequate compared to what it used to be. Because the institution is expanding, the number of patients are increasing, and there are so many needs. And you will agree with me that even the social amenities are not the way they used to be. We don't get light 24/7. And the hospital have to survive, and we depend on light to do so many things. With water, we have to survive. We have to source for some of these things locally. And so all of that put a toll on the finances of the institution.
I want to ask you, is there a connection between drug abuse or substance abuse and corruption in the nation?
A lot of the high-profile people in the society they may not own up, but we are aware that some are just like anything that the people do. Some are involved in it. Some have their own aids that they use for their whatever that are involved in this thing. So corruption is been there. Drug abuse is part of the problem of corruption in the society, in the sense that people, grow some of these drugs locally, they export them. Some people get them from different countries and they export, and all of that are part of corruption.
I ask this question because when you look at our leaders, if they've been connected with substance abuse, it then put them in a very wrong direction in managing the nation very well. Have you seen occurrences of substance abusers being in government?
Not directly. What we are used to is that there are aids. For example, during campaign period, most of the people you see snatch ballot buses are high on one substance or the other. And they have big shots in politics who have their backbone. So most of them, when they are arrested...
maybe inherently drug abusers too.
Well,
okay, you want to say
I won't want to say that because I don't have evidence of that.
It is okay. But I can understand your position. When we, as an addiction counselor, how will you want to advise the youth?
Oh, my advice to the youth is that don't get involved in substance abuse. It should be a no-go area. One, as a youth, many of them are still in school. Even if you are learning a trade, it will affect your brain, and it reduces your ability to function academically, socially, and productively in whatever you are doing. And then it put a strain between you and your family. And ultimately, it will affect the individual health. The vital organs of the body will go for it. And the end result is untimely death. And it brings you head-on collision with the law. And so anybody doing drug is going to have a confrontation with the law at one point or the other. And then the health is going to be at risk. The health of
well, you've just had an addiction counselor telling you addiction is a monster. It lives inside, feeds off you, and takes from you, controls you, and then destroys you. That's a word of advice from a consultant and medical sociologist. It's been a wonderful time with Pastor Anthony Ogbemudia, Ogbebor, who has been discussing on the issue of abating substance abuse in the society. This is Your Image, your public relations TV program. Next week, we'll be having a partner in Solace Foundation. Solace Foundation is having an advocacy group that is relating on substance abuse and issues of mental health. And we'll have a partner joining us in the person of Olori Amina Adeleye Machemilola, the Olori of Olowo of Owo, who have found a place to begin to address such issues in the society. Until next week, remember, I'm still your uncle, Akin Okudero. God bless you. Next week.